ExamPrep.School. National Certified Guardian, exam code CGC. There are 4 practice exams in this series. This video covers Practice Exam 1, which is free. In this video, we will be covering the following major categories for Practice Exam 1. Application of surrogate decision-making, financial management, knowledge of laws, courts, and legal processes, knowledge of the person, medical decision-making, personal management, professional practices. Let's walk through the format. I'll read each question and its choices. Let's get started. Question 1. Which statement best describes the primary purpose of the Center for Guardianship Certification Code of Ethics? A. To prescribe legal filing and court procedures for guardianship petitions. B. To establish standards of professional conduct and ethical decision-making for certified guardians. C. To define minimum financial compensation rates for guardians in practice. D. To mandate specific investment guidelines for guardians managing estates. A countdown circle appears in the top right. Once it completes, the answer is revealed. You can pause at any time if you'd like longer to think. If you'd like additional practice covering more topics, see the description for our book. The correct answer is B. The Code of Ethics is designed to set forth professional and ethical conduct standards for certified guardians, guiding their decision-making and behavior in practice. Reason A is not correct. The code does not detail court filing procedures. It focuses on professional conduct. Reason C is not correct. It does not address compensation rates, but rather ethical and professional standards. Reason D is not correct. It does not prescribe investment rules, but rather overarching ethical guidelines. Question 2. Under the duty of loyalty in the CGC Code of Ethics, a guardian is required to A. Maintain strict confidentiality of all ward records at all times. B. Avoid conflicts of interest and place the ward's interests above personal gain. C. File all compliance reports within specified court deadlines. D. Ensure that least restrictive alternatives are used in every case. The correct answer is B. The duty of loyalty obligates a guardian to avoid self-dealing, conflicts of interest, and to prioritize the ward's interests ahead of personal or third-party interests. Reason A is not correct. While confidentiality is important, it is not the core of the duty of loyalty. Reason C is not correct. Timely reporting relates to compliance, not specifically to loyalty obligations. Reason D is not correct. Choosing least restrictive alternatives pertains to decision-making, not loyalty. Question 3. A guardian oversees a client's estate and is offered an expensive trip by the client's adult child in exchange for adjusting allocations to favor them. Which action best upholds the principle of integrity and professional conduct? A. Accept the trip and divide assets equally among heirs. B. Accept the trip only after obtaining written consent from the client. C. Accept the trip and later report the transaction to the oversight agency. D. Decline the offer and disclose the proposal to the court. The correct answer is D. The correct answer is to decline the offer and disclose it to the court, demonstrating integrity by refusing undue influence and maintaining transparency. Reason A is not correct. Dividing assets equally still involves accepting an improper benefit and overlooks the undue influence. Reason B is not correct. Obtaining consent does not mitigate the ethical breach of accepting an improper gift. Reason C is not correct. Accepting the trip before reporting fails to prevent the conflict and compromises integrity. Question 4. A guardian contracted by a community agency also works part-time as a consultant for a vendor that provides supported living to the same client. What is the most appropriate step to avoid a dual role conflict? A. Resign from the vendor contract to focus solely on guardianship. B. Limit consulting services to periods outside case management duties. C. Disclose the arrangement to the agency and continue both roles. D. Transfer the vendor consulting to a colleague while remaining guardian. The correct answer is A. The correct answer is to resign from the vendor contract, which prevents bias and preserves impartial decision-making by eliminating the conflicting role. Reason B is not correct. Limiting hours does not resolve the intrinsic conflict of interest inherent in holding both positions. Reason C is not correct. Disclosure alone fails to eliminate potential bias between the roles. Reason D is not correct. Transferring consulting still maintains a connection that could influence guardianship decisions. Question 5. A guardian learns that a potential placement facility is owned by a close friend who offers to give priority placement to the client. To maintain objectivity in decision-making, what should the guardian do? A. Obtain quotes from several facilities, evaluate merits, and document selection rationale. B. Select the facility to expedite placement because of the personal relationship. C. Accept the friend's facility offer and disclose the relationship in reports. D. Decline the friend's offer and avoid consideration of that facility altogether. The correct answer is A. The correct answer is to obtain and compare multiple proposals, ensuring decisions are based on objective criteria rather than personal ties. Reason B is not correct. Choosing based on relationship undermines impartial evaluation of the best options. Reason C is not correct. Disclosure without objective comparison still biases the decision process. Reason D is not correct. Rejecting without assessment fails to consider potentially suitable care options. Question 6. A client under guardianship consistently requests attending weekly religious services that their family deems unnecessary and burdensome. Which action best respects the client's expressed wishes? A. Suspend attendance pending a family committee review. B. Allow attendance only on principal religious feast days. C. Arrange transportation and support for weekly religious services. D. Petition the court to forbid attendance based on family objections. The correct answer is C. The correct answer is to arrange transportation and support for weekly services, honoring the client's autonomy by facilitating their clearly expressed preference. Reason A is not correct. Suspending visits prioritizes family concerns over the client's autonomy. Reason B is not correct. Restricting attendance fails to honor the frequency specified by the client. Reason D is not correct. Forbidding attendance contradicts the client's clearly expressed wishes without justification. Question 7. A client refuses a court-ordered feeding tube, citing discomfort, but the healthcare team warns of imminent weight loss. To adhere to non-maleficence, how should the guardian proceed? A. Respect the refusal and coordinate alternative dietary supplements. B. Consent to feeding tube placement despite the client's objections. C. Seek an emergency hearing to enforce the court order. D. Temporarily suspend all nutritional interventions pending family consensus. The correct answer is A. The correct answer is to respect the refusal and explore less invasive nutritional options, thereby avoiding harm while honoring the client's wishes. Reason B is not correct. Forcing treatment violates the duty to avoid harm by disregarding expressed refusal. Reason C is not correct. Pursuing enforcement escalates conflict and may harm the client psychologically. Reason D is not correct. Suspending interventions risks neglecting the client's health needs. Question 8. Under standard guardianship ethics guidelines, which of the following scenarios exemplifies a direct financial conflict of interest by a guardian regarding the ward's assets? A. Transferring ward funds into the guardian's personal savings account. B. Soliciting additional court fees to enhance the court's revenue. C. Seeking competitive bids for ward home maintenance services. D. Requesting reimbursement for travel expenses when attending ward medical appointments. The correct answer is A. This option is correct because transferring ward funds into the guardian's personal savings account constitutes self-dealing and directly violates fiduciary duty to keep ward assets separate and solely for the ward's benefit. Reason B is not correct. This is not a personal financial benefit to the guardian, but relates to court revenue, not ward assets. Reason C is not correct. Competitive bidding for maintenance services reflects appropriate stewardship, not personal gain. Reason D is not correct. Reimbursing travel expenses for ward-related medical appointments is a permissible expense, not a personal profit. Question 9. A professional guardian is considering entering into a service contract with a company owned by a close friend to provide home maintenance for the ward's residents. Under related party transaction rules, what is the guardian's best course of action? A. Petition the court for approval before entering into the transaction. B. Proceed if the fees are fair market value and notify the court afterward. C. Enter into the agreement if it clearly benefits the ward without notifying the court. D. Only avoid contracts with immediate family members. The correct answer is A. The guardian must seek prior court authorization for any transaction involving a related party to ensure impartial oversight and protect the ward's interests. Reason B is not correct. Waiting to notify the court until after the transaction fails to meet the requirement for prior approval. Reason C is not correct. Even a beneficial deal does not eliminate the need for court authorization before a related party transaction. Reason D is not correct. Rules typically cover all related parties, not just immediate family, so narrowing to family is too restrictive. Question 10. A guardian receives a referral fee from a residential facility for every ward placed there. Which practice most directly violates referral kickback prohibitions? A. Accepting occasional meals from the facility valued under $25. B. Sharing transportation costs with the facility for ward visits. C. Receiving a payment for each ward referral to the facility. D. Disclosing referral arrangements to the ward's family. The correct answer is C. Accepting compensation tied to referrals is categorically prohibited to prevent conflicts of interest and ensure placement decisions serve the ward's best interest. Reason A is not correct. Nominal meals do not constitute referral fees and are typically allowed under token value exceptions. Reason B is not correct. Cost sharing for legitimate expenses differs from receiving referral compensation for placements. Reason D is not correct. Disclosure alone does not legitimize prohibited referral payments under anti-kickback rules. Question 11. A care provider sends the guardian an expensive wristwatch valued at $200 as a thank you gift. According to gifts and gratuities thresholds, what should the guardian do? A. Return the gift and disclose the offer to the court. B. Keep the watch since gifts under $250 are allowed. C. Donate the watch to the ward's personal estate. D. Accept the gift but document it in the ward's file. The correct answer is A. Gifts exceeding the modest value threshold must be declined and disclosed to maintain impartiality and comply with court oversight requirements. Reason B is not correct. The threshold is lower than $200, so retaining the gift violates policy. Reason C is not correct. Donating on behalf of the ward does not remedy acceptance of a prohibited gift. Reason D is not correct. Retention of high-value items, even if documented, breaches the gratuities policy. Question 12. Under the HIPAA minimum necessary rule, which of the following disclosures of protected health information is subject to the minimum necessary requirement? A. Disclosure to another healthcare provider for treatment purposes. B. Disclosure to the individual who is the subject of the information. C. Disclosure for research when an institutional review board has waived authorization. D. Disclosure to a public health authority for disease control activities. The correct answer is C. The minimum necessary rule applies to disclosures for research when authorization is waived by an IRB, whereas disclosures for treatment, to the patient, and to public health authorities are exempt from this requirement. Reason A is not correct. Disclosures for treatment are exempt from the minimum necessary rule because providers need full information to treat patients safely. Reason B is not correct. Disclosures to the individual who is the subject of the information are exempt, since patients have the right to access their own PHI without limitation. Reason D is not correct. Disclosures to public health authorities are exempt under the public interest exception and are not governed by the minimum necessary rule. Question 13. As a court-appointed guardian, you receive a request from a hospital to release your ward's medical records. The hospital presented a signed authorization form from the ward, but the form lacks the facility's name and date ranges. According to confidentiality regulations, what is the appropriate next step? A. Request a corrected authorization that includes the facility name and specific date ranges. B. Release the records immediately to avoid delaying care. C. Deny the request until a court order is obtained. D. Provide an abbreviated summary of treatment instead of full records. The correct answer is A. The correct answer is to request a corrected authorization form that specifically identifies the facility and date range, as HIPAA requires clear, specific authorization before releasing protected health information. Reason B is not correct. Releasing without proper specifics violates HIPAA requirements for valid authorization. Reason C is not correct. A court order isn't necessary when a valid authorization can be secured with required details. Reason D is not correct. Providing only a summary does not satisfy the request for full records under proper authorization guidelines. Question 14. Your ward's adult child asks you for detailed information about the ward's mental health treatment plan. The ward has not signed any release of information. Under confidentiality and guardianship regulations, what is the guardian's most appropriate response? A. Explain that guardian may share treatment details upon determining it is in the ward's best interest. B. Direct the adult child to request information directly from the treating provider. C. Provide a general summary of treatment goals without details as a compromise. D. Inform the adult child that treatment details cannot be shared without the ward's consent or court order. The correct answer is D. The correct answer is to inform the adult child that no information can be shared without the ward's consent or court order, as mental health records are protected under confidentiality regulations. Reason A is not correct. Guardians do not have unilateral authority to override confidentiality for mental health records. Reason B is not correct. Providers cannot release information without proper authorization. The guardian must secure consent or legal directive first. Reason C is not correct. Even summaries of protected health information require valid authorization or court order before disclosure. Question 15. According to quality assurance protocols in guardianship, which event would most likely necessitate an immediate incident report? A. A client repeatedly declines participation in prescribed physical therapy. B. A client voices dissatisfaction with meal options provided. C. A client sustains a femoral fracture after a fall at a residential facility. D. A client challenges minor inaccuracies in support service billing. The correct answer is C. This answer is correct because a severe injury, such as a femoral fracture, constitutes a reportable incident under guardianship quality assurance standards, requiring formal documentation and review. Routine complaints about meals, therapy refusals, or billing disputes do not trigger incident reports unless they involve harm or safety risks. Reason A is not correct. Refusal of prescribed therapy reflects a care choice issue, not a safety or injury event requiring formal reporting. Reason B is not correct. Voicing dissatisfaction with meals is feedback on service preferences rather than a safety incident and is not reportable. Reason D is not correct. Disputing billing inaccuracies is an administrative matter and does not trigger an incident report absent a safety concern. Question 16. A guardianship agency's quality assurance team identifies a pattern of medication administration errors across several cases. After defining the problem and collecting relevant incident data, what should the team do next as part of a root cause analysis? A. Implement staff retraining on medication procedures to address skill gaps. B. Convene a multidisciplinary group to brainstorm all potential underlying causes. C. Escalate the issue to senior management for immediate disciplinary action. D. Monitor error rates for another month before planning further interventions. The correct answer is B. The correct answer is to convene stakeholders for brainstorming potential underlying causes, which is the next root cause analysis step after data collection. Reason A is not correct. Retraining is an intervention step and should follow analysis of identified causes rather than precede understanding root causes. Reason C is not correct. Disciplinary action bypasses the analytical process and does not identify why errors are occurring. Reason D is not correct. Delaying action to collect more monitoring data postpones analysis and does not advance understanding of underlying causes. Question 17. During a quarterly review, a guardianship supervisor discovers that financial accounting errors persist despite previous corrective efforts. When drafting a corrective action plan to address these errors, which element is most essential to ensure effective implementation and evaluation? A. A detailed narrative describing each accounting error identified. B. A broad objective to improve overall accounting accuracy. C. A list of staff members responsible for general oversight functions. D. Specific measurable performance targets, assigned responsibilities, and deadlines. The correct answer is D. This option is correct because effective corrective action plans require clear performance metrics, assigned accountability, and timelines to track progress and ensure compliance. Reason A is not correct. Descriptive narratives lack metrics and do not provide a basis for measuring improvement or accountability. Reason B is not correct. Broad objectives fail to define specific outcomes and cannot guide actionable steps or evaluation. Reason C is not correct. Listing oversight roles without defined metrics and deadlines does not ensure implementation or progress measurement. Question 18. Which fee is typically defined within a court-approved guardianship fee schedule? A. Annual subscription fee for electronic case management. B. Maximum hourly rate payable to a professional guardian. C. Percentage-based commission on the ward's estate distributions. D. Flat filing fee for appellate guardianship proceedings. The correct answer is B. The correct answer is a maximum hourly rate cap, as court-approved guardianship fee schedules commonly set hourly rate limits for guardian services, whereas the other fees are not standard elements of such schedules. Reason A is not correct. Electronic case management subscriptions are operational costs, not established in guardianship fee schedules. Reason C is not correct. Commission percentages on estate distributions are more typical of conservatorship trusts, not standard guardianship fee schedules. Reason D is not correct. Appellate filing fees are statutory court fees and not part of a guardianship fee schedule. Question 19. After completing a 2-hour home visit with a ward, a professional guardian often waits until the end of the week to enter all of her time in the electronic system and provides only general descriptions of activities. To improve accuracy and compliance with timekeeping best practices, which approach would be most effective? A. Mandate supervisory approval of any weekly time log before it is entered into the electronic system. B. Require submission of all time entries by close of business on the next business day following each client visit. C. Ask an assistant to jot down paper notes during each visit and batch transcribe them into the system at month's end. D. Configure the timekeeping system to issue a prompt immediately after each logged activity, requiring entry of precise start, end times, and activity details before proceeding. The correct answer is D. The most effective practice is to prompt immediate entry of precise times and detailed activity descriptions after each session, which minimizes memory decay and ensures audit-ready records. Reason A is not correct. Requiring supervisory approval adds administrative burden and does not address the root issue of delayed generalized entries. Reason B is not correct. Allowing next-day entry still risks detail loss and recall errors compared to immediate prompts after each activity. Reason C is not correct. Batch transcription from paper at month's end introduces significant recall gaps and increases risk of lost or illegible notes. Question 20. According to person-centered planning principles, which type of question is most effective for eliciting an individual's values and life goals? A. Leading questions that imply preferred answers. B. Closed-ended questions requiring brief responses. C. Open-ended questions that encourage detailed narratives. D. Rhetorical questions intended for reflection. The correct answer is C. Open-ended questions are most effective in person-centered planning because they encourage individuals to articulate their own values and life goals without constraint. Reason A is not correct. Leading questions bias responses and limit authentic self-expression. Reason B is not correct. Closed-ended questions restrict responses to predefined options. Reason D is not correct. Rhetorical questions do not solicit substantive personal input. Question 21. Within person-directed planning meetings, which participant holds the principal locus of control according to standard person-centered planning principles? A. The independent plan facilitator. B. A designated family surrogate. C. The individual for whom the plan is developed. D. The appointed legal guardian. The correct answer is C. Person-directed planning grants the individual themselves the principal locus of control in meetings to ensure that decisions align with their preferences and goals. Reason A is not correct. The facilitator supports but does not hold ultimate decision-making authority. Reason B is not correct. Family surrogates may advise but do not retain principal planning control. Reason D is not correct. Legal guardians provide oversight but do not control person-directed meetings. Question 22. During a guardianship assessment, the guardian meets with Mark, who lists several activities he enjoys in the evening. Which approach best documents his preference hierarchy? A. Record each activity preference in a free text field in the order he mentions them. B. Use a three-tiered scale labeling preferences as must-have, nice-to-have, or optional, and note activities accordingly. C. List all activities alphabetically and mark his preferred ones with a star. D. Note only his top preference to avoid overwhelming the preference chart. The correct answer is B. Using a three-tiered scale systematically captures and distinguishes primary, secondary, and tertiary preferences, providing clear structure for decision-making. Reason A is not correct. A free text list lacks structured tiers and makes it difficult to compare relative importance. Reason C is not correct. Alphabetical ordering does not reflect the strength or priority of preferences. Reason D is not correct. Recording only the top preference omits important secondary and tertiary options in the hierarchy. Question 23. A guardian supports Nawaz, who practices daily religious rituals and observes weekly services. Which action best respects and integrates his religious observances into his support plan? A. Schedule routine family visits on major religious holidays to encourage participation. B. Integrate his established prayer and worship times into the daily schedule based on his expressed needs. C. Provide an overview of various faith traditions and ask him to select one. D. Encourage attendance at community social events unrelated to his faith to broaden interactions. The correct answer is B. Incorporating specific prayer and worship times aligns care with his established religious routine, demonstrating respect and support for his observances. Reason A is not correct. Visits on religious holidays may be intrusive if not aligned with his personal practice schedule. Reason C is not correct. Offering a broad overview does not address his own articulated observances or routines. Reason D is not correct. Unrelated social events ignore the importance of his faith-based activities to his well-being. Question 24. Sophie has limited verbal communication and struggles to express her mealtime preferences. Which intervention best supports her choice-making using communication aids? A. Speak louder and repeat each question to ensure she hears correctly. B. Provide a picture board with icons representing her meal options and allow her to point. C. Ask her long-term caregiver to choose meals on her behalf based on past meals. D. Use only closed yes, no questions to narrow down options quickly. The correct answer is B. A picture board with clear icons facilitates independent choice-making by matching her expressive needs and supporting visual communication. Reason A is not correct. Increasing volume does not address her expressive or comprehension challenges. Reason C is not correct. Caregiver selection bypasses her opportunity to communicate personal preferences. Reason D is not correct. Limiting to yes-no questions restricts nuance and does not offer visual support. Question 25. Prior to obtaining informed consent for a new therapy, the guardian meets with Carlos, who expresses his reasons and concerns. Which documentation method best records his informed preferences? A. Record only the final decision without noting the rationale to streamline records. B. Document the discussion details and Carlos's stated reasons in a formal decision log with his signature. C. Ask the medical provider to enter his preferences into the clinical chart only. D. Note his preferences verbally in meeting minutes without date or signature for brevity. The correct answer is B. A formal decision log with both rationale and signature ensures that his informed preferences and reasons are clearly recorded for future reference. Reason A is not correct. Omitting rationale fails to document why he made that choice, limiting informed consent evidence. Reason C is not correct. Relying solely on the provider's chart entry may omit the guardian's independent record of expressed reasons. Reason D is not correct. Undated, unsigned notes lack formality and reliability for informed consent documentation. Question 26. Which of the following factors is not included in the four-factor analysis recommended by the Department of Justice for determining language assistance obligations to individuals with limited English proficiency? A. The proportion of limited English proficiency individuals served by the entity. B. The frequency of contact with limited English proficiency individuals. C. The importance of the specific service or program. D. Projected future growth of the limited English proficiency population. The correct answer is D. The four-factor analysis includes the number and proportion of LEP persons served, the frequency of contact, the importance of the service, and the resources available and costs. Projected future growth is not one of these factors. Reason A is not correct. This refers to the number and proportion of LEP persons, which is one of the required factors. Reason B is not correct. This describes the frequency of contact with LEP individuals, which is one of the required factors. Reason C is not correct. This addresses how critical the service is, which is one of the required factors. Question 27. A guardian is arranging communication support for a ward who speaks a rare indigenous language. During a scheduled court hearing, the guardian must select an interpreter. Which action best aligns with professional standards for interpreter selection? A. Engage a court-certified professional interpreter, unaffiliated with the person or their family, for all legal proceedings. B. Use a local community member fluent in the person's dialect and well-known in their cultural community to assist during meetings. C. Assign a bilingual staff member familiar with the person's background but lacking formal interpreter credentials. D. Rely on an automated online translation tool supplemented by Guardian review after sessions. The correct answer is A. The correct answer ensures use of a neutral, court-certified interpreter, meeting ethical, legal, and accuracy requirements for rare language proceedings. Reason B is not correct. Community members may lack formal certification and impartiality, risking misinterpretation and confidentiality breaches. Reason C is not correct. Staff without credentials may not meet professional standards, increasing error risk and ethical concerns. Reason D is not correct. Automated tools lack cultural nuance and accuracy required for legal and ethical compliance. Question 28. A guardian oversees meal planning for a ward who observes strict religious dietary laws. To respect the ward's religious practice, which accommodation best demonstrates cultural competency and compliance? A. Implement rotating cultural menus that include occasional halal dishes, depending on supplier availability and menu planning. B. Offer a rotating vegetarian and vegan menu designed to exclude non-halal ingredients and accommodate general dietary needs. C. Provide kosher-certified meals procured from a local provider as a substitute to ensure avoidance of prohibited items. D. Provide halal-certified meals that are prepared in a separate kitchen and served without cross-contamination. The correct answer is D. The correct answer directly addresses specific religious requirements by using halal-certified preparation and service protocols, ensuring respect and compliance. Reason A is not correct. Including occasional halal options without dedicated preparation risks cross-contamination and inconsistent compliance. Reason B is not correct. Vegetarian menus avoid meat but do not satisfy religious requirements around halal slaughter and certification. Reason C is not correct. Kosher guidelines differ from halal and may not fulfill the ward's specific religious mandates. Question 29. Which of the following fracture patterns in an infant is most specific for signaling non-accidental injury rather than accidental trauma? A. Metaphyseal corner fractures. B. Posterior rib fractures. C. Linear skull fractures. D. Clavicular fractures. The correct answer is A. The correct answer is metaphyseal corner fractures because they occur at the growth plate due to shearing forces and are highly specific for non-accidental trauma in infants. Posterior rib fractures are suspicious but less specific. Linear skull fractures often result from accidental falls, and clavicular fractures can be common birth injuries or minor falls. Reason B is not correct. Posterior rib fractures, though concerning, can sometimes occur accidentally from compressive forces. Reason C is not correct. Linear skull fractures frequently arise from falls and lack the specific shearing mechanism seen in abuse. Reason D is not correct. Clavicular fractures often result from birth trauma or minor accidental falls, making them less specific for abuse. Question 30. During a routine visit, a case manager reviews the bank statements of an 80-year-old ward with mild dementia. The statements reveal multiple large cash withdrawals on days when the ward was accompanied by a cousin who insisted on handling the transactions. Which finding most strongly indicates potential financial exploitation? A. A sharp increase in credit card charges for medical supplies. B. Automatic mortgage payments withdrawn each month. C. Consistent monthly direct deposits from Social Security. D. Repeated large cash withdrawals conducted by the cousin without receipts. The correct answer is D. The repeated large cash withdrawals conducted by the cousin without documentation is a classic red flag for financial exploitation, as it suggests unauthorized access and lack of transparency. Reason A is not correct. An increase in medical charges is expected with health needs and does not necessarily indicate exploitation. Reason B is not correct. Automatic mortgage payments are normal fiduciary duties and not a sign of exploitation. Reason C is not correct. Regular Social Security deposits are typical income sources and not exploitative. Question 31. A guardian receives letters from a ward indicating that the ward's personal attorney demands to sit in on every meeting and discourages all contact with friends and family, warning that outsiders have malicious motives. The ward appears anxious and reluctant to speak freely. Which behavior best exemplifies undue influence? A. Arranging for the ward to attend community support groups. B. Consistently forgetting scheduled appointments. C. Isolating the ward from trusted relatives and friends. D. Recommending a new financial advisor to the ward. The correct answer is C. Isolating the ward from trusted relatives and friends is a hallmark of undue influence, as it severs natural supports and increases dependency on the influencer. Reason A is not correct. Encouraging social engagement supports autonomy and is not undue influence. Reason B is not correct. Forgetting appointments reflects memory issues rather than manipulation by another. Reason D is not correct. Suggesting a financial advisor alone does not necessarily restrict choice or isolate the ward. Question 32. During a home visit, a guardian observes that a ward has collected spoiled food in the refrigerator, animal feces scattered on the floor, and has not bathed or changed clothes for several days. Which observation is the clearest indicator of self-neglect? A. Unpaid utility and rent bills piling up. B. Irregular attendance at scheduled medical appointments. C. Biohazard conditions present throughout the living areas. D. Refusal to talk about personal medical concerns. The correct answer is C. The presence of biohazard conditions such as spoiled food and animal waste directly reflects impaired self-care and home maintenance, characteristic of self-neglect. Reason A is not correct. Financial delinquency may indicate hardship but not necessarily self-neglect behaviors. Reason B is not correct. Missing appointments reflects non-adherence but not direct evidence of daily living neglect. Reason D is not correct. Reluctance to discuss health is common anxiety and not the strongest marker of self-neglect. Question 33. Which of the following practices aligns most closely with trauma-informed communication principles when interacting with individuals who have experienced trauma? A. Prioritizing accuracy over empathy. B. Using technical terminology. C. Minimizing trauma discussions. D. Using clear and consistent language. The correct answer is D. This option reflects trauma-informed communication by promoting clarity and predictability, which supports safety and reduces confusion or inadvertent triggering of trauma responses. Reason A is not correct. Emphasizing accuracy over empathy can undermine emotional safety, as trauma-informed approaches prioritize supportive understanding. Reason B is not correct. Technical terminology may create barriers and inhibit rapport by causing confusion or distancing the communicator. Reason C is not correct. Avoiding discussions of trauma can invalidate experiences and hinder trust. Trauma-informed communication acknowledges trauma sensitively. Question 34. A guardian meets with an adult ward who has a developmental disability and limited verbal skills. The guardian wants the ward to choose between two residential options. Which approach best supports meaningful participation? A. Ask open-ended questions about each option and wait for a verbal response. B. Pose simple yes/no questions orally to determine a preference. C. Show pictures of each option on a choice board and ask the ward to point to the preferred one. D. Request that the ward's family select the option on their behalf. The correct answer is C. This option best matches the ward's communication needs by using visual supports and simple selection methods, enabling genuine choice and autonomy. Reason A is not correct. Open-ended questions without visual supports may overwhelm someone with limited verbal skills and impede clear choice. Reason B is not correct. Yes, no questions alone may not provide enough context for an informed decision in someone with expressive language challenges. Reason D is not correct. Having family decide fails to promote the ward's self-determination and does not build communication skills. Question 35. Which feature distinguishes an eco-map from a genogram in mapping a person's natural support network? A. Displaying organizational hierarchy within formal care agencies. B. Emphasis on hereditary lineage and family medical history. C. Detailing a chronological timeline of significant life events. D. Illustrating relationships with non-family community supports beyond familial connections. The correct answer is D. The correct answer is distinguished by the inclusion of non-family individuals and groups, which is a hallmark of ecomaps, whereas genograms focus on family lineage and medical history. Reason A is not correct. Organizational hierarchies illustrate formal agency structure, not informal support networks. Reason B is not correct. Genograms focus on familial lineage and hereditary patterns, not mapping community supports. Reason C is not correct. Chronological timelines reflect sequencing of life events rather than depicting support relationships. Question 36. You are facilitating a family meeting for an adult ward whose relatives hold divergent views on care routines. Some family members dominate the discussion while others remain silent. To promote balanced participation and ensure all perspectives are heard, which strategy should you implement? A. Begin the meeting without a set agenda to allow relatives to freely raise concerns in any order. B. Provide a clear agenda beforehand specifying topics and time allotments, and establish rules to ensure each person speaks. C. Collect written feedback from relatives in advance, and center the meeting on reviewing those comments. D. Offer to make care decisions directly to prevent prolonged debate during the meeting. The correct answer is B. The correct answer is providing a clear agenda with time allocations and enforcing ground rules, which creates structure, manages dominant voices, and encourages quieter members to contribute. Reason A is not correct. Allowing the meeting to proceed without an agenda may let dominant relatives steer the conversation and discourage quieter members from speaking up. Reason C is not correct. Focusing solely on written feedback may overlook spontaneous concerns in the meeting and inhibit real-time dialogue among family members. Reason D is not correct. Making decisions unilaterally bypasses family input and fails to address the goal of balanced participation during the meeting. Question 37. Which of the following best describes the substituted judgment standard used by surrogate decision makers? A. Making decisions based on the person's best interests and welfare. B. Deferring to the choices of the person's next of kin. C. Following a court-appointed guardian's discretionary judgment. D. Determining what the person would have chosen based on their known values and preferences. The correct answer is D. This standard directs decision makers to determine what the individual would have chosen by applying their previously expressed values, preferences, and beliefs to current decisions. Reason A is not correct. Making decisions solely on best interests uses an objective assessment of welfare, not the person's own preferences. Reason B is not correct. Deferring to family choices relies on surrogate default hierarchy, not the individual's prior values. Reason C is not correct. Relying on a guardian's discretion centers on legal authority rather than reconstructing the person's own decision. Question 38. A guardian is deciding whether to hospitalize a ward with advanced dementia who has developed aspiration pneumonia. According to the best interest standard, which factor should carry the greatest weight in the decision? A. Balance potential benefits against hospitalization burdens. B. Ward's previously expressed treatment preferences. C. Guardian's personal beliefs about quality of life. D. Costs of inpatient versus outpatient care. The correct answer is A. The best interest standard requires evaluating objective benefit versus burden, rather than relying on substituted judgment or cost considerations. Reason B is not correct. Previously expressed preferences apply to substituted judgment, not best interest criteria. Reason C is not correct. Personal beliefs reflect subjective values and are not the primary concern under best interest. Reason D is not correct. Cost considerations are financial factors and not central to best interest determinations. Question 39. A guardian is evaluating whether to enroll a ward with chronic heart failure in a clinical trial that offers potential symptom relief but carries significant arrhythmia risk. When applying the best interest standard to weigh risks and benefits, what should the guardian focus on? A. Comparing likelihood and severity of benefits to harms. B. Consulting with the trial's financial sponsors regarding risk plans. C. Ensuring any risks are reversible if complications arise. D. Prioritizing comfort preferences over objective risk estimates. The correct answer is A. Weighing risks and benefits requires systematic comparison of the probabilities and magnitudes of potential benefits versus harms under the best interest standard. Reason B is not correct. Sponsor consultations address logistics, not the comparative risk-benefit analysis required by best interest. Reason C is not correct. Reversibility pertains to mitigation, not the core weighing of risk versus benefit. Reason D is not correct. Comfort preferences reflect substituted judgment rather than objective risk-benefit evaluation. Question 40. A guardian recalls that a ward orally stated 3 years ago that she never wanted to be kept alive on artificial ventilation. The ward is now incapacitated with respiratory failure. Under the substituted judgment standard, what is the most appropriate action? A. Honor the ward's prior oral statement about artificial ventilation. B. Require written advance directive before honoring the statement. C. Seek agreement from the medical team before documenting it. D. Defer to current family opinions on life support. The correct answer is A. Substituted judgment allows credible prior oral statements to guide decisions when the individual's intent is clear and specific. Reason B is not correct. Written directives are not strictly required when reliable oral statements exist. Reason C is not correct. Medical team agreement may inform but does not establish the ward's own prior intent. Reason D is not correct. Family opinions reflect others' views rather than the ward's expressed wishes. Question 41. A guardian receives conflicting reports. A nursing aide states that the ward consistently refuses wound care, while the ward's family reports acceptance. To evaluate the reliability of the ward's stated preference, what should the guardian do first? A. Assess context, timing, and consistency of the ward's refusals. B. Honor the most recent statement reported by the family. C. Default to the clinical team's treatment recommendation. D. Implement the least restrictive care option, regardless of preference. The correct answer is A. Assessing consistency across situations is the primary method for determining the reliability of an incapacitated person's expressed preferences. Reason B is not correct. Family reports are secondhand and require verification of the ward's own consistency. Reason C is not correct. Clinical recommendations address medical appropriateness, not reliability of patient statements. Reason D is not correct. Least restrictive approaches may overlook reliable evidence of the ward's true wishes. Question 42. Which of the following best defines the concept of task-specific capacity in guardianship decision-making? A. The ability to perform activities of daily living without assistance. B. A global assessment of a person's overall cognitive functioning across domains. C. The determination of an individual's ability to understand and decide on a particular decision at a specific time. D. An evaluation of an individual's financial literacy and management skills. The correct answer is C. The correct answer defines task-specific capacity as the contextual assessment of understanding and decision-making for one particular task at a given moment, distinguishing it from global or functional evaluations. Reason A is not correct. This description focuses on functional abilities rather than the cognitive understanding required for a specific decision. Reason B is not correct. This choice describes an overall cognitive evaluation rather than the capacity to make one particular decision. Reason D is not correct. This option pertains to financial skill assessment and not the contextual decision-making capacity for a single task. Question 43. A legal guardian consents to an elective surgical procedure for an adult ward after reviewing the operation's benefits, risks, and side effects, but is not informed that non-surgical alternatives exist. Which element of informed consent is deficient? A. Assessment of decision-making capacity. B. Verification of comprehension. C. Disclosure of alternatives. D. Ensuring voluntariness. The correct answer is C. The correct answer is disclosure of alternatives, since informed consent requires presenting all reasonable options, including non-surgical treatments. Reason A is not correct. This option addresses capacity assessment, but the guardian's understanding of alternatives, not capacity determination, is at issue. Reason B is not correct. Verifying comprehension evaluates understanding, but here information about options was withheld. Reason D is not correct. Ensuring voluntariness involves absence of coercion, which is not relevant to the missing information. Question 44. A ward with mild cognitive impairment expresses a clear housing preference when aided by a trusted family friend, but cannot articulate pros and cons unaided. According to the principle of supported decision-making, what should the guardian do first? A. Conduct a formal capacity evaluation before any decision-making supports. B. Arrange a meeting including the ward and the family friend to help explore housing options. C. Make an executive decision based on the ward's best interests. D. Seek a court order to establish a substitute decision maker. The correct answer is B. The correct answer is arranging a meeting with the ward and a trusted supporter, since supported decision-making requires facilitating assistance before substituting judgment. Reason A is not correct. Formal capacity evaluations should follow, not precede, attempts to provide decision-making support. Reason C is not correct. Making a unilateral best interest decision bypasses the ward's involvement. Reason D is not correct. Seeking a court order ignores less restrictive supported decision-making options. Question 45. A guardian is assisting a ward who struggles to compare multiple assisted living options. Which action best exemplifies a graduated decision support approach? A. Providing the ward with a comprehensive brochure listing all facility metrics and asking for a choice. B. Offering stepwise aids beginning with a simple checklist, then visual charts, and finally guided discussions. C. Completing the selection on behalf of the ward to expedite housing placement. D. Directing the ward to choose the option deemed most cost-effective. The correct answer is B. The correct answer is offering progressively more detailed supports, which embodies graduated decision supports by scaffolding the decision process. Reason A is not correct. A single brochure is not a graduated support. It provides all information at once. Reason C is not correct. Completing the selection denies the ward any decision-making involvement. Reason D is not correct. Directing the ward to a cost-effective option imposes the guardian's preference without support. Question 46. A ward must decide whether to change long-term care facilities. The guardian explains the risks and benefits, then asks the ward to summarize the information in their own words. Which strategy is the guardian using to evaluate decisional understanding? A. Observing the ward's nonverbal reactions during the explanation. B. Documenting the ward's signature on the consent form. C. Asking the ward to restate the benefits and risks in personal terms. D. Requesting a family member to interpret the ward's level of understanding. The correct answer is C. The correct answer is asking the ward to restate information, known as the teach-back method, which directly assesses understanding. Reason A is not correct. Nonverbal cues are unreliable measures of comprehension. Reason B is not correct. A signature confirms consent but does not assess understanding. Reason D is not correct. Relying on a family member does not directly evaluate the ward's own comprehension. Question 47. Under most state guardianship statutes, a guardian's authority regarding a ward's visitors in the ward's residence is best described as which of the following? A. The guardian may prohibit visitors at any time if deemed necessary. B. The guardian may restrict visitors only with prior court approval. C. The guardian may limit visitors during designated hours without approval. D. The guardian has no authority to regulate visitors under any condition. The correct answer is B. This option is correct because state statutes generally require court authorization before a guardian may impose restrictions on who may visit the ward in the ward's own residence. Reason A is not correct. Statutes do not grant guardians unilateral power to prohibit visitors without court oversight. Reason C is not correct. Statutes do not permit time-based visitor limits without obtaining judicial sanction. Reason D is not correct. Guardians can regulate visitors, but only if the court first grants that authority. Question 48. Which action best supports the individual's right to community integration while responsibly addressing safety concerns? A. Collaborate with community center staff and arrange accessible transportation and staff support for the workshop. B. Petition the court to obtain authority for escorted community outings. C. Deny participation based on concerns about safety risks. D. Require completion of a comprehensive vocational assessment before allowing participation. The correct answer is A. The correct answer supports autonomy by facilitating participation through practical supports, aligning with the least restrictive measures for community integration. Reason B is not correct. Seeking court authority for escorted outings creates unnecessary legal barriers rather than addressing practical supports. Reason C is not correct. Denying participation eliminates the opportunity for community integration and overrides the right to inclusion. Reason D is not correct. Mandating a vocational assessment before participation imposes an undue prerequisite that restricts access. Question 49. What is the most appropriate action to advocate for the individual's freedom from restraint while ensuring safety? A. Approve mechanical restraint use only when staff are properly trained. B. Accept proposed restraint use but request time-limited court authorization. C. Recommend filing a formal complaint against staff for proposing restraints. D. Develop a positive behavior support plan after conducting a functional behavioral assessment and train staff in de-escalation techniques. The correct answer is D. The correct answer prioritizes least restrictive intervention by identifying behavior triggers and implementing positive supports, aligning with the individual's right to freedom from restraint. Reason A is not correct. Authorizing restraints, even with training, still imposes a restrictive intervention as a first response. Reason B is not correct. Seeking court authorization still permits restraint use rather than proactively promoting alternative interventions. Reason C is not correct. Filing a complaint is adversarial and does not directly establish or implement less restrictive support strategies. Question 50. Under typical guardianship statutes, which of the following best describes the authority distinction between plenary and limited guardianship? A. A limited guardian's decision-making scope is confined to areas specified in the appointment order, while a plenary guardian has authority over all aspects of the ward's personal and property affairs. B. A limited guardian must obtain court approval for each substantive decision, whereas a plenary guardian can act autonomously without periodic judicial review. C. A limited guardian serves for a fixed term subject to renewal hearings, whereas a plenary guardian holds office until the ward's death or further court order. D. A limited guardian can only make emergency decisions, while a plenary guardian handles ongoing care and financial matters. The correct answer is A. The correct answer is that a limited guardian's powers are specifically enumerated by the court order, whereas a plenary guardian is granted comprehensive authority over both personal and financial decisions. Reason B is not correct. Requiring court approval for each decision is not the defining distinction. A plenary guardian may still be subject to periodic review in some jurisdictions. Reason C is not correct. Term length and renewal hearings are procedural matters and do not by themselves define plenary versus limited authority. Reason D is not correct. Emergency decision-making is only one aspect of limited guardianship and does not capture the broader scope difference. Question 51. In statutory guardianship frameworks, temporary emergency guardianship is most appropriately used when A. A ward's incapacity is permanent and no family members are immediately available to assume long-term guardianship. B. A crisis poses an imminent risk of serious harm to the ward, and there is insufficient time to complete formal guardianship proceedings. C. The previously appointed guardian is indisposed, but a successor has not yet been named by the court. D. There is a dispute among family members regarding long-term care, and the court seeks time to evaluate complex issues. The correct answer is B. The correct answer is that temporary emergency guardianship is designed for situations of imminent harm where expedited authority is needed before standard guardianship proceedings can be completed. Reason A is not correct. Permanent incapacity without an available caregiver would call for standard guardianship, not the temporary emergency form. Reason C is not correct. Succession gaps are managed through successor guardianship procedures, not emergency guardianship. Reason D is not correct. Family disputes over long-term care require standard or temporary guardianship, but not specifically emergency appointment unless there is imminent harm. Question 52. Under standard guardianship statutes, which requirement must typically be satisfied for a successor guardian to assume authority after the original guardian's removal or resignation? A. The successor guardian must re-evaluate the ward's capacity through a new medical examination. B. The successor guardian must petition the court and obtain a formal order confirming the successor appointment. C. The successor guardian automatically succeeds by virtue of a designation in the original guardianship order. D. The successor guardian must secure consent from the ward's next of kin before assuming duties. The correct answer is B. The correct answer is that successor guardians must file a petition and receive a formal court order to assume the full powers of guardianship. Reason A is not correct. A capacity evaluation may be relevant to initial guardianship, but is not a prerequisite for a successor appointment. Reason C is not correct. Automatic succession is not permitted. Courts must review and confirm the successor guardian. Reason D is not correct. Consent from next of kin is not a statutory requirement for successor guardian appointment. Question 53. A court appoints Lillian as guardian of the person and Michael as guardian of the estate for Janet. Janet needs an elective outpatient surgery and payment arrangements. Under typical state authority divisions, which guardian has the authority to provide informed consent for the surgery? A. Michael, the guardian of the estate, because the surgery cost could be substantial. B. Janet herself, because elective procedures are not covered by guardianship authority. C. Lillian, the guardian of the person, because consenting to medical procedures falls under personal decision-making authority. D. Both guardians jointly must consent before proceeding. The correct answer is C. The guardian of the person is empowered to make personal decisions, such as consenting to medical treatments, while the guardian of the estate manages financial matters. Reason A is not correct. The guardian of the estate handles financial affairs but does not have authority to consent to medical procedures. Reason B is not correct. Guardianship includes authority to consent to medical treatments when the ward lacks capacity, even for elective procedures. Reason D is not correct. Medical consent does not require joint action by both guardians unless the court order specifies shared decision-making. Question 54. Anna and Bob are appointed co-guardians for Colin without any court stipulation of unilateral authority. Anna unilaterally reduces Colin's monthly cable subscription to save costs, and Bob objects. Under standard co-guardianship authority sharing rules, how should the legality of Anna's action be characterized? A. Binding because each co-guardian can independently manage routine expenses. B. Automatically valid for minor modifications that do not affect the ward's health. C. Valid if the cost savings exceed statutory thresholds for incidental expenditures. D. Non-binding until both co-guardians' consent or court approval is obtained. The correct answer is D. Co-guardians generally must act jointly unless the court explicitly grants independent authority. So unilateral decisions by one guardian are non-binding until ratified by the other or the court. Reason A is not correct. Co-guardians cannot make binding decisions independently without joint agreement or a court directive. Reason B is not correct. Even minor financial modifications require joint agreement under standard co-guardianship rules, unless specified otherwise by the court. Reason C is not correct. Statutory thresholds for incidental expenditures do not override the requirement for joint consent absent explicit court authorization. Question 55. Which of the following elements is a mandatory component of a guardianship appointment petition under most state statutes? A. A summary of any prior guardianship proceedings. B. The proposed guardian's name and address. C. A detailed accounting of the ward's assets. D. A medical treatment plan for the ward. The correct answer is B. The correct answer is that the proposed guardian's name and address must be included, because state statutes uniformly require identification of the individual seeking appointment in the petition. Reason A is not correct. A summary of prior proceedings is required only if a prior guardianship exists, not in every initial petition. Reason C is not correct. An asset accounting is typically submitted later in fiduciary reports rather than in the initial appointment petition. Reason D is not correct. A medical treatment plan is not a required element in the appointment petition. Medical evaluations may be attached separately. Question 56. Under the Uniform Probate Code guidelines adopted by many states, service of process on a proposed ward must occur at least how many days before the scheduled guardianship hearing? A. 10 calendar days. B. 14 calendar days. C. 7 business days. D. 30 calendar days. The correct answer is B. The correct answer is 14 calendar days because the UPC guidelines require personal service on the proposed ward at least 2 weeks before the hearing. Reason A is not correct. 10 days is shorter than the 2-week minimum established under UPC provisions. Reason C is not correct. The requirement is stated in calendar days, not business days, and the minimum is longer than 7 days. Reason D is not correct. 30 days exceeds the minimum time frame set by the UPC guidelines. Question 57. Which of the following persons is generally classified as an interested party entitled to notice of a guardianship hearing? A. The ward's primary care physician. B. An adult sibling of the proposed ward. C. A neighbor who assists the ward with errands. D. A volunteer guardian advocate assigned by a nonprofit. The correct answer is B. The correct answer is an adult sibling. because statutes define interested parties to include next of kin and other close relatives entitled to notice. Reason A is not correct. A primary care physician is not automatically classified as an interested party for notice under most guardianship statutes. Reason C is not correct. Neighbors providing informal assistance are not considered statutory interested parties entitled to notice. Reason D is not correct. Volunteer advocates may participate but are not automatically entitled to formal notice as interested parties. Question 58. A guardianship petition has been filed against Mr. Lopez, and he has been served with notice of the initial hearing date. At the hearing, Mr. Lopez indicates he was unaware of any right to counsel prior to today. Under due process requirements, when must the court inform a respondent of their right to counsel? A. Within 24 hours of filing the petition. B. At the same time the notice of hearing is served. C. Immediately before any evidence is taken at the hearing. D. After closing arguments but before issuing a decision. The correct answer is C. The correct answer is that due process mandates informing the respondent of the right to counsel immediately before any evidence is taken, ensuring informed participation in the hearing. Reason A is not correct. There is no requirement to inform within 24 hours of filing. Due process focuses on ensuring knowledge at the time evidence is taken. Reason B is not correct. Though notice of hearing and right to counsel are often served together, due process specifically requires reiteration before evidence begins. Reason D is not correct. Waiting until after closing arguments would deprive the respondent of counsel during the hearing proceedings. Question 59. Despite proper service of notice, Ms. Chang does not appear at the scheduled guardianship hearing and no attorney is present on her behalf. Under due process principles governing respondent presence, what action should the court take? A. Appoint counsel to represent her and then continue the hearing. B. Proceed with the hearing in her absence. C. Issue a bench warrant to secure attendance before proceeding. D. Dismiss the petition without prejudice due to her absence. The correct answer is A. The correct action is to appoint counsel and continue the hearing, which safeguards the respondent's rights when the respondent fails to appear but has no representation. Reason B is not correct. Proceeding without representation would violate due process protections for the respondent. Reason C is not correct. Issuing a bench warrant is more appropriate for criminal cases, not civil guardianship proceedings without immediate danger. Reason D is not correct. Dismissing the petition would undermine the purpose of the guardianship process when proper notice was given. Question 60. Under the Uniform Guardianship, Conservatorship, and Other Protective Arrangements Act 2017, within how many days after issuance of letters of guardianship must the guardian file the initial guardianship care plan with the court? A. 30 days. B. 45 days. C. 60 days. D. 90 days. The correct answer is C. The correct answer is 60 days because the Model Act's Section 417 stipulates that the initial care plan must be submitted within 60 days of issuance of letters to ensure timely court oversight. Reason A is not correct. A 30-day filing window is shorter than the period specified by the statute. Reason B is not correct. A 45-day period does not satisfy the Model Act's minimum requirement of 60 days. Reason D is not correct. A 90-day time frame exceeds the maximum period established by the statute. Question 61. Under the Uniform Guardianship, Conservatorship, and Other Protective Arrangements Act 2017, an annual personal status report filed by a guardian is generally required to include all of the following except A. Description of the ward's physical and mental condition. B. Current residential arrangements. C. Summary of social and recreational activities. D. Detailed fiduciary accounting. The correct answer is D. Annual personal status reports focus on non-financial aspects of the ward's well-being, while detailed fiduciary accounting is addressed in separate financial filings under the Model Act. Reason A is not correct. Physical and mental condition details are central to assessing the ward's personal status. Reason B is not correct. Residential arrangements must be reported to review living conditions. Reason C is not correct. Social and recreational activities are included to evaluate quality of life. Question 62. A guardian submits an annual financial accounting to the court, but later realizes a $200 therapy expense was omitted. According to typical court requirements, what should the guardian do to ensure compliance? A. Personally pay for the session to avoid reporting it. B. Categorize the $200 session as a general administrative expense on the next report. C. Defer reporting the session until the following annual accounting period. D. File an amended financial accounting with full disclosure of the omitted expense. The correct answer is D. This option is correct because courts require guardians to amend submitted reports promptly and fully disclose omitted transactions to maintain accurate records. Reason A is not correct. Covering the cost personally fails to correct the public record and leaves the accounting incomplete. Reason B is not correct. Grouping the session under general administrative expenses misrepresents the specific nature of the transaction. Reason C is not correct. Delaying disclosure to the next period violates timeliness and accuracy requirements for financial reports. Question 63. A guardian files the initial inventory of the ward's assets within the 90-day deadline but discovers 2 months later that a rental property valued at $50,000 was omitted. Under typical guardianship statutes, what action best remedies this deficiency? A. Submit a notation in the next annual accounting instead of amending the inventory. B. Request the court to waive the omission penalty due to oversight. C. List the omitted property in a supplemental inventory only if its value changes. D. File a supplemental inventory amending the initial listing to include the rental property. The correct answer is D. This option is correct because statutes require guardians to file supplemental inventories for omitted assets to maintain accurate court records and full disclosure. Reason A is not correct. Notations in an accounting fail to correct the initial inventory record required by the court. Reason B is not correct. Asking for a waiver does not satisfy the statutory obligation to update the asset list. Reason C is not correct. Conditional listing based on value changes disregards the duty to list all assets regardless of later valuation. Question 64. Which element is a required practice for maintaining fidelity to person-centered care planning by ensuring ongoing alignment with an individual's evolving preferences and goals? A. Conducting periodic collaborative plan reviews with the individual and their support network. B. Implementing standardized 6-month clinical evaluations. C. Establishing uniform agency-wide intervention protocols. D. Preparing annual resource allocation projections based solely on historical expenditures. The correct answer is A. This option is correct because periodic collaborative plan reviews actively engage the individual and their support network to incorporate changes in preferences, abilities, and goals, which is central to person-centered care planning. Reason B is not correct. Standardized clinical evaluations occur at fixed intervals and focus on clinical metrics rather than tracking personal preferences. Reason C is not correct. Uniform agency-wide protocols apply the same interventions to all individuals and overlook unique needs and goals. Reason D is not correct. Annual financial projections based on past spending do not capture real-time changes in personal priorities or circumstances. Question 65. Alex is managing care for Ms. Thompson, whose primary care physician and cardiologist use incompatible electronic health systems and have provided conflicting dosage recommendations. Lab results are delayed, leading to treatment gaps. Which approach would most effectively align care plans and reduce communication delays? A. Rotate written referral letters between providers monthly. B. Ask Ms. Thompson to transport her medical records to each appointment. C. Schedule joint appointments at a single facility on alternating months. D. Develop a shared electronic care plan, accessible by all treating clinicians. The correct answer is D. The correct answer is to develop a shared electronic care plan because it enables real-time access to consistent clinical information, reducing discrepancies and delays in communication among providers. Reason A is not correct. Rotating referral letters still requires manual transfers and does not ensure up-to-date information is shared in real time. Reason B is not correct. Relying on the patient to carry records does not guarantee providers will review or update critical data promptly. Reason C is not correct. Joint appointments may introduce scheduling conflicts and do not resolve electronic interoperability issues. Question 66. Maria is the legal guardian for Mr. Lee, who is due for both a colonoscopy and a mammogram based on age and risk factors. Considering his diabetes and mobility limitations, how should Maria prioritize and schedule these preventive screenings to optimize health outcomes? A. Schedule screenings 6 months apart to monitor tolerance and recovery. B. Book colonoscopy first, followed by mammogram on the same day. C. Combine both procedures on the same day at different facilities. D. Schedule the mammogram first and then the colonoscopy after fasting preparation. The correct answer is D. The correct answer is to schedule the mammogram first and then the colonoscopy after fasting preparation, because the mammogram has no dietary restrictions, allowing the patient to complete it before initiating colonoscopy prep requirements. Reason A is not correct. Spreading screenings 6 months apart is unnecessary and may delay detection without added benefit. Reason B is not correct. Booking both on the same day may be logistically challenging and does not account for colonoscopy preparation needs. Reason C is not correct. Combining at different facilities risks delays and increases patient burden without improving prep coordination. Question 67. Jordan coordinates transportation for Ms. Alvarez, who requires weekly dialysis and occasional specialist visits. Recent rides have been canceled last minute, causing missed treatments. What is the most effective strategy to ensure reliable transportation services? A. Schedule all rides through a single on-call dispatch service. B. Ask Ms. Alvarez to use public transit with a taxi voucher. C. Secure a contract with a primary transport provider and a backup vendor. D. Provide training to Ms. Alvarez on ride booking apps. The correct answer is C. The correct answer is to secure contracts with both a primary provider and a backup vendor, creating system redundancy that minimizes the risk of last-minute cancellations and missed treatments. Reason A is not correct. Relying on a single dispatch service offers no contingency if that service fails or is overbooked. Reason B is not correct. Public transit and taxi vouchers may introduce delays and accessibility challenges not suited for dialysis schedules. Reason D is not correct. Training the patient on apps does not mitigate provider-side cancellations or availability issues. Question 68. Which standardized assessment focuses on instrumental activities of daily living to evaluate a person's suitability for independent living? A. Lawton Instrumental Activities of Daily Living Scale. B. Katz Index of Independence in Activities of Daily Living. C. Mini Mental State Examination. D. Geriatric Depression Scale. The correct answer is A. The Lawton Instrumental Activities of Daily Living Scale evaluates tasks such as managing finances, transportation, and medication management, which are key indicators of independent living ability. Reason B is not correct. This index measures basic self-care activities rather than the broader tasks involved in independent living. Reason C is not correct. This examination screens cognitive function, but does not specifically evaluate daily living tasks required for independent community residents. Reason D is not correct. This scale assesses mood and depression levels but does not measure functional abilities related to independent living. Question 69. A 78-year-old ward with early-stage dementia requires daily medication administration and occasional vital sign monitoring. When choosing between assisted living facilities, which factor should the guardian prioritize to ensure continuity of care? A. Proximity to the ward's primary care physician's office. B. Variety of social and recreational activities available on site. C. Availability of 24-hour on-site licensed nursing staff. D. Monthly cost relative to the ward's long-term care budget. The correct answer is C. The correct answer is chosen because continuity of care for daily medication and vital sign monitoring requires on-site licensed nursing staff. While location, activities, and cost are important, they do not directly address the medical oversight needs described. Reason A is not correct. Proximity can facilitate follow-up appointments but does not guarantee necessary clinical oversight for daily medication administration. Reason B is not correct. Social activities enhance quality of life but do not ensure the clinical monitoring required for daily medication and vital signs. Reason D is not correct. Cost considerations are important but should not override the need for licensed nursing oversight when medical needs are present. Question 70. Following a stroke, a ward has impaired mobility and requires daily skilled physical therapy sessions. Which admission criterion best qualifies the ward for placement in a Medicare-certified skilled nursing facility? A. Assistance with dressing and bathing due to reduced mobility. B. Requirement for daily skilled physical therapy to improve function. C. Need for 24-hour supervision to prevent falls. D. Preference for structured social and recreational programs. The correct answer is B. The correct answer is selected because Medicare-certified skilled nursing placement requires a documented need for daily skilled therapy services. Assistance with activities of daily living, supervision needs, or social preferences do not meet the skilled care threshold. Reason A is not correct. Assistance with dressing and bathing is considered custodial care and does not qualify for skilled nursing placement. Reason C is not correct. Supervision to prevent falls is a safety measure but does not constitute skilled nursing or therapy services. Reason D is not correct. Structured social programs enhance quality of life but are not a basis for skilled nursing admission under Medicare rules. Question 71. A guardian is reviewing state regulations before opening a group home for 5 adults with developmental disabilities. Which requirement is mandated by typical state licensing for this type of residence? A. Each direct care staff member must complete only 2 hours of annual in-service training. B. A staff-to-resident ratio of no less than 1:8 during waking hours. C. State licensure must be renewed every 5 years. D. Documented monthly fire safety drills for all residents and staff. The correct answer is D. The correct answer is based on common state licensing regulations that require regular fire safety drills to ensure resident and staff preparedness. Training hours and renewal periods vary by state, and staff ratios are often stricter than 1:8. Reason A is not correct. Annual in-service training requirements typically exceed 2 hours and vary by state. This minimal amount is insufficient for licensing. Reason B is not correct. Staff-to-resident ratios are generally lower, more staff per resident, than 1.8 to ensure adequate supervision. Reason C is not correct. Licensure renewal periods are usually annual or biennial rather than every 5 years. Question 72. According to best practices for guardianship oversight, what is the minimum recommended frequency for a guardian's face-to-face visits to monitor an adult ward's health status? A. Once per month. B. Every 3 months. C. Every 6 months. D. Once per year. The correct answer is C. This option is correct because guardianship best practices call for at least semi-annual visits to assess health status and mitigate risks. Reason A is not correct. Monthly visits exceed the minimum requirement and may not be feasible given resource constraints. Reason B is not correct. Quarterly visits exceed the standard semi-annual interval and are not required under typical guidelines. Reason D is not correct. Annual visits are less frequent than the guideline of semi-annual visits and may risk missing changes in health status. Question 73. Which method provides the most objective measure for a guardian to verify a ward's medication adherence? A. Self-report medication diaries. B. Pharmacy refill records. C. Pill counts during visits. D. Electronic medication reminders. The correct answer is C. This option is correct because pill counts during visits allow guardians to directly measure remaining doses, providing objective data on medication ingestion. Reason A is not correct. Self-reported diaries are subject to recall bias and may not accurately reflect ingestion. Reason B is not correct. Refill records show if prescriptions are filled, but cannot confirm that medications were actually taken. Reason D is not correct. Reminder systems can prompt doses but do not confirm whether the ward ingested the medication. Question 74. An 82-year-old client with mild cognitive impairment lives alone and has experienced 2 falls in poorly lit areas of the home over the past month. A recent review noted multiple trip hazards and lack of support rails. Which fall risk reduction strategy is most appropriate for this client? A. Implement a progressive strength and balance exercise program at an outpatient facility. B. Conduct a multidisciplinary home safety assessment and install grab bars in key areas of the home. C. Arrange a medication review to taper sedative and anticholinergic agents. D. Provide non-skid rugs and install battery-operated nightlights in each room. The correct answer is B. The correct answer is conducting a home safety assessment to identify hazards and installing grab bars, which directly addresses environmental risks and compensates for cognitive limitations to prevent falls. Reason A is not correct. Strength and balance training can reduce fall risk over time but may be less immediately effective for cognitive impairment and existing environmental hazards. Reason C is not correct. Medication review is important but may not address immediate physical hazards in the home that contributed to recent falls. Reason D is not correct. Non-skid rugs can introduce new trip hazards and nightlights alone do not eliminate structural risks like missing grab bars. Question 75. A 78-year-old client with congestive heart failure and mild dementia has lost 5% of body weight over 2 weeks and reports decreased thirst awareness. Which nutrition and hydration monitoring strategy is most appropriate? A. Instruct the client to self-assess skin turgor each morning. B. Order bi-weekly serum electrolyte panels to detect early dehydration. C. Schedule monthly full nutritional evaluations by a dietitian. D. Use the mini nutritional assessment weekly and maintain daily fluid intake logs for caregiver review. The correct answer is D. The correct answer is using the mini nutritional assessment weekly combined with daily fluid logs, which provides standardized screening and direct monitoring of intake to detect changes quickly. Reason A is not correct. Skin turgor assessment is unreliable in the elderly and does not quantify actual intake or weight changes. Reason B is not correct. Electrolyte panels detect dehydration late and are more invasive rather than directly monitoring intake or weight trends. Reason C is not correct. Monthly evaluations are too infrequent to identify rapid changes in nutrition or hydration status. Question 76. As of 2023, what is the maximum countable asset limit for an individual to remain eligible for supplemental security, income SSI? A. $2,000. B. $2,500. C. $1,800. D. $3,000. The correct answer is A. The SSI program sets the individual countable asset limit at $2,000. Amounts above this threshold render one ineligible. Reason B is not correct. This exceeds the allowable countable asset limit for individual SSI eligibility. Reason C is not correct. This amount is below the established limit and would not fully utilize the permissible threshold. Reason D is not correct. This amount surpasses the maximum countable resource threshold for individual SSI eligibility. Question 77. After how many months of receiving Social Security Disability Insurance SSDI benefits does an individual typically qualify for Medicare coverage? A. 12 months. B. 48 months. C. 36 months. D. 24 months. The correct answer is D. Medicare eligibility for SSDI beneficiaries begins after a 24-month waiting period of benefit receipt. Reason A is not correct. Medicare does not begin after just 1 year of SSDI benefit receipt. Reason B is not correct. Coverage begins earlier than 4 years of benefit receipt. Reason C is not correct. The waiting period is shorter. Coverage begins before 36 months. Question 78. Under Medicaid's medically needy spend-down provisions, which expense is generally not deductible when calculating countable income? A. Medicare Part B premiums. B. Prescription drug copayments. C. Private health insurance premiums. D. Mortgage or rent payments. The correct answer is D. Medicaid spend-down allows deduction of medical expenses and insurance premiums, but not routine housing costs like mortgage or rent payments. Reason A is not correct. These premiums are considered medical expenses and can be deducted. Reason B is not correct. Prescription copayments qualify as medical expenses for spend-down. Reason C is not correct. Private health insurance premiums are allowed deductions under the spend-down. Question 79. Mr. Thompson is a 67-year-old guardian ward who turned 65 on October 15th of last year. His guardian missed enrolling him in Medicare Part B during his initial enrollment window. It is now February 20th. Which Medicare enrollment period should the guardian use to sign him up for Part B and avoid late enrollment penalties? A. Initial enrollment period. B. Special enrollment period. C. General enrollment period. D. Annual election period. The correct answer is C. The general enrollment period, which runs from January 1st to March 31st each year, is the correct avenue for someone who missed their initial enrollment and does not qualify for a special enrollment period. This period allows enrollment in Part B with a possible late enrollment penalty applied from the missed deadline. Reason A is not correct. The initial enrollment period applies around the 65th birthday and was already missed in this scenario. Reason B is not correct. A special enrollment period requires specific qualifying events which are not present here. Reason D is not correct. The annual election period pertains to Medicare Advantage and Part D choices each fall, not initial Part B enrollment. Question 80. According to the Uniform Guardianship Accounting Principles UGAP, an inventory of a ward's personal property generally must document each item's details except which of the following? A. Serial number or other unique identifier. B. Current physical condition. C. Date of most recent appraisal. D. Location where the item is stored. The correct answer is C. The correct answer is the date of the most recent appraisal. UGAP requires documenting identifiers, condition, and storage location, but appraisal dates are not mandatory. Reason A is not correct. Unique identifiers are essential to distinguish similar items and prevent misplacement. Reason B is not correct. Condition assessments help track wear, damage, and maintenance needs over time. Reason D is not correct. Recording storage location ensures accessibility and proper safeguarding of the property. Question 81. According to widely accepted guardianship property management standards, securing a ward's real property assets typically includes all of the following except A. Verifying adequate hazard insurance coverage. B. Performing a structural engineering inspection. C. Securing external entry points against unauthorized access. D. Transferring utility accounts into the ward's name. The correct answer is B. The correct answer is performing a structural engineering inspection. Standard practices require hazard insurance, secured entry points, and utilities in the ward's name, but not a formal engineering review. Reason A is not correct. Hazard insurance is critical to protect against damage and liability risks. Reason C is not correct. Securing entry points prevents unauthorized access and vandalism. Reason D is not correct. Utilities must be in the ward's name to ensure service continuity and accurate billing. Question 82. A guardian is preparing to sell a ward's residential property and needs an accurate valuation to satisfy court requirements. After reviewing tax assessor records and online estimates, which step should the guardian take next? A. Request a comparative market analysis from a real estate agent familiar with the neighborhood. B. Hire a state-licensed certified real estate appraiser to perform a formal valuation. C. Use an online home value estimator tool to determine current market price. D. Rely on the county tax assessor's valuation as the property's fair market value. The correct answer is B. The correct answer is to hire a state-licensed, certified real estate appraiser because a formal appraisal by a qualified professional meets court standards and accurately determines fair market value. Reason A is not correct. A comparative market analysis is informal and does not satisfy legal requirements for a court-approved valuation. Reason C is not correct. Online estimators lack the professional certification and data rigor required for a legally defensible appraisal. Reason D is not correct. Tax assessor values are for taxation purposes and do not reflect an up-to-date market valuation required by the court. Question 83. A guardian plans to sell a ward's vehicle that is no longer needed and must obtain legal authorization before proceeding. Which action best fulfills the court's requirements for sale authorization? A. Complete the private sale and then notify the court of the sale terms. B. Submit a formal petition to the court detailing the proposed sale price and need for authorization. C. Request a letter from the DMV approving the vehicle's sale. D. File an application for guardianship of the vehicle with the court. The correct answer is B. The correct answer is to submit a formal petition to the court with details of the proposed sale and justification, as guardians must obtain court approval prior to selling ward's assets. Reason A is not correct. Selling before approval violates court procedures that require authorization prior to any transaction. Reason C is not correct. The DMV processes title transfers but does not grant legal authority for asset sales under guardianship. Reason D is not correct. Guardianship over a vehicle is inherent in the ward's guardianship. A sale requires specific court authorization rather than a new application. Question 84. Which definition accurately describes the fiduciary duty of loyalty owed by a guardian? A. Obligation to avoid self-dealing and conflicts of interest in representing the ward. B. Requirement to balance the ward's expressed preferences with resource constraints. C. Duty to invest the ward's assets to generate maximum financial return. D. Obligation to maintain detailed records of the ward's medical and care decisions. The correct answer is A. The duty of loyalty requires the guardian to place the ward's interests above any personal or third-party interests and to avoid self-dealing or conflicts. Reason B is not correct. Balancing preferences with resources relates more to the best interest standard, not specifically loyalty. Reason C is not correct. Maximizing financial return is part of the duty of care, not duty of loyalty. Reason D is not correct. Maintaining care records is an administrative duty and does not define loyalty obligations. Question 85. Which practice is required to comply with trust account segregation mandates for guardian-managed funds? A. Maintaining the ward's funds in an account separate from the guardian's personal and business funds. B. Investing the ward's funds exclusively in low-risk government securities. C. Pooling funds of multiple wards into a single, undifferentiated account. D. Retaining all transaction records in paper form in the guardian's office file. The correct answer is A. Segregation rules mandate that the guardian keep the ward's assets in a distinct account, separate from any personal or business funds to prevent commingling. Reason B is not correct. Investment restrictions are governed by prudent standards, not segregation requirements. Reason C is not correct. Pooling without identifiers violates segregation by commingling separate wards funds. Reason D is not correct. Record retention does not satisfy the requirement to keep funds in a separate account. Question 86. A guardian is preparing a $10,000 disbursement for emergency boiler repairs in the ward's home. The fiduciary accounting policy requires 2 signatures from authorized signatories. The primary co-signer is out of town until next week and no designated alternate signatory is listed. Which action best complies with the 2-signature control policy and the guardian's fiduciary responsibilities? A. Contact the bank to designate an alternate signatory to co-sign and then issue the check. B. Obtain court approval to allow a single signature disbursement for the emergency. C. Sign the check alone due to the emergency and note the reason in official records. D. Delay the boiler repair until both authorized signatories are available. The correct answer is A. This option is correct because the 2-signature control policy typically includes the appointment of alternate authorized signatories for situations when a primary signatory is unavailable. Designating an alternate ensures policy compliance and timely disbursement for emergency repairs. Reason B is not correct. Obtaining court approval is unnecessary for designating an internal alternate signatory and would delay the emergency repair. Reason C is not correct. Signing alone violates the 2-signature requirement and undermines the policy's internal control measures. Reason D is not correct. Delaying necessary emergency repairs jeopardizes the ward's well-being and ignores available policy mechanisms. Question 87. Which element of informed consent is assessed by evaluating a patient's ability to understand information, appreciate the consequences, reason about options, and communicate a choice? A. Disclosure. Providing information on the relevant risks, benefits, and alternatives of a proposed treatment. B. Comprehension. The patient's accurate understanding of the information presented regarding the procedure. C. Voluntariness. Ensuring the patient's decision is made free of coercion and undue external influence. D. Capacity. The patient's ability to understand, appreciate, reason about clinical options, and communicate a decision. The correct answer is D. Capacity is correct because it encompasses the patient's ability to understand relevant information, appreciate medical consequences, reason through alternatives, and communicate a decision. Reason A is not correct. This option refers only to the provision of information rather than evaluating the patient's decision-making abilities. Reason B is not correct. This option pertains solely to understanding information and does not include appreciation of consequences, reasoning, or communication. Reason C is not correct. This option focuses on freedom from coercion rather than on the cognitive processes underlying informed decision-making. Question 88. Maria is the court-appointed guardian for 25-year-old Mark, who has moderate intellectual disability. His primary care physician recommends routine annual vaccination and basic blood tests. Which action should the guardian take? A. Provide consent for the vaccination and blood tests under existing authority. B. Petition the court for approval before providing routine vaccinations. C. Decline consent and defer to the physician's judgment without signature. D. Notify the court within 48 hours after obtaining consent. The correct answer is A. The correct answer is that the guardian may provide consent for routine preventive care and basic tests under the existing medical decision-making authority without seeking additional court approval. Reason B is not correct. Routine preventive care is covered under standard guardianship authority, so a court petition is not required. Reason C is not correct. Deferring without signing neglects the guardian's role of providing consent when capacity is limited. Reason D is not correct. There is no post-consent reporting requirement for routine vaccinations under the existing guardianship order. Question 89. Under the existing guardianship for Robert, the court order authorizes medical care but explicitly prohibits major surgical interventions. The surgeon now recommends a hip replacement to restore mobility. What is the guardian's appropriate next step? A. Sign consent for the hip replacement under general medical authority. B. Arrange for physical therapy rather than surgical repair. C. Request a second medical opinion without seeking court review. D. Petition the court to expand authority to include the surgical intervention. The correct answer is D. The correct answer is to file a petition to expand the guardian's authority before consenting to any major surgery because the existing order specifically excludes such interventions. Reason A is not correct. Major surgeries are prohibited by the guardianship order, so signing consent would exceed authority. Reason B is not correct. Physical therapy may not meet medical necessity and does not resolve the requirement for court authorization of surgery. Reason C is not correct. A second opinion does not address the legal prohibition against major surgical procedures. Question 90. Sarah is the guardian for 42-year-old Tom, who has chronic renal disease but demonstrates understanding of his condition and treatment risks. Tom consistently refuses the recommended hemodialysis. Which action should the guardian take? A. Seek a court order to mandate dialysis against his wishes. B. Override the refusal based on the guardian's best interest standard. C. Arrange involuntary hospitalization to ensure treatment adherence. D. Respect the refusal and document the decision after confirming capacity. The correct answer is D. The correct answer is to respect and document the informed refusal after confirming that capacity exists, because a capable individual's refusal must be honored. Reason A is not correct. Mandating treatment would violate the rights of a person with confirmed capacity to refuse. Reason B is not correct. Overriding a capable individual's refusal contravenes the principle of autonomy. Reason C is not correct. Involuntary hospitalization is inappropriate when an individual demonstrates decision-making capacity. Question 91. James, a ward under guardianship, is unconscious after a car accident and arrives at the emergency department. His guardian cannot be reached and no advance directives are available. The attending physician requests consent for a life-saving blood transfusion. Which principle permits proceeding without consent? A. Implied consent for emergency, life-saving interventions. B. Requirement to obtain an ex parte court order before treatment. C. Suspension of guardianship authority during hospitalization. D. Need for guardian's retrospective approval after stabilization. The correct answer is A. The correct answer is that emergency life-saving interventions may proceed under the doctrine of implied consent when no surrogate or advance directive is available. Reason B is not correct. Waiting for a court order could cause harmful delays in emergency care. Reason C is not correct. Guardianship authority remains unless legally terminated. It is not suspended by hospitalization. Reason D is not correct. Retrospective approval is not required to proceed with emergency care under implied consent. Question 92. Which of the following is a primary responsibility of a guardian when interpreting a POLST form? A. Serve as the authorized signatory to complete the POLST form on the patient's behalf. B. Confirm the POLST form aligns with the patient's current treatment preferences and carries a valid clinician signature. C. Independently modify medical orders on the POLST form when the patient's clinical status changes. D. File and maintain the POLST form in court records after appointment as guardian. The correct answer is B. Guardians must verify that POLST documents accurately represent the patient's current treatment preferences and are properly endorsed by an authorized clinician. They do not sign, amend, or file the form themselves. Reason A is not correct. Guardians do not serve as signatories. Only clinicians authorized to write medical orders complete and sign POLST forms. Reason C is not correct. Guardians must consult the clinician of record for any changes and cannot unilaterally modify medical orders. Reason D is not correct. Guardians are responsible for maintaining a copy but are not required to file the POLST with the court. Question 93. A 78-year-old patient with terminal heart failure and advanced dementia is admitted after progressive decline. The patient has an existing do not resuscitate DNR order. The spouse requests that all other life-sustaining treatments except CPR be administered. Which of the following best describes the scope of the DNR order? A. Chest compressions, defibrillation, and intubation are all withheld under the DNR order. B. Chest compressions and defibrillation are withheld. Other treatments like intubation require separate orders. C. All life-sustaining measures, including antibiotics and intravenous fluids, are withheld under the DNR order. D. Only chest compressions are withheld, while defibrillation and intubation proceed automatically. The correct answer is B. This option is correct because a DNR order applies specifically to CPR interventions, chest compressions, and defibrillation, and does not automatically include other life-sustaining treatments such as intubation or mechanical ventilation, which require their own directives. Reason A is not correct. Withholding intubation overextends the DNR order since airway management is a separate decision unless a specific DNI is in place. Reason C is not correct. A DNR does not encompass broader treatments like antibiotics or fluid management, which must be specified separately. Reason D is not correct. Defibrillation is part of CPR and is withheld under a standard DNR, so it cannot proceed automatically. Question 94. A 65-year-old patient in a persistent vegetative state has an advance directive refusing artificial nutrition and hydration. The guardian must decide whether to honor this directive as the patient approaches end of life. Which rationale best supports withholding artificial nutrition under these circumstances? A. Artificial nutrition is considered basic care and must always be provided regardless of advance directives. B. Artificial nutrition serves solely for comfort and cannot be ethically withheld. C. Guardians should never withhold nutrition due to potential religious objections from family members. D. Artificial nutrition is a medical intervention that can be withheld if burdens outweigh benefits according to patient wishes. The correct answer is D. This option is correct because artificial nutrition is classified as a medical treatment rather than basic care and may be withheld if it conflicts with the patient's advance directive and if the burdens of treatment outweigh its benefits. Reason A is not correct. Artificial nutrition is not considered basic care in this clinical context, but rather a medical intervention subject to patient-directed choices. Reason B is not correct. Artificial nutrition provides nutritional support beyond comfort. Its withholding must be based on burden-benefit analysis. Reason C is not correct. Religious objections do not override a patient's explicit advance directive refusing artificial nutrition. Question 95. During a care planning meeting, the guardian discusses hospice services with the clinical team. The patient has metastatic cancer and a prognosis of 6 months. The family insists on continued aggressive treatment. What key point should the guardian emphasize about hospice eligibility? A. Enrollment disqualifies the patient from receiving any hospital-based treatments. B. Eligibility requires a life expectancy of 6 months or less if the disease follows its typical course. C. Hospice covers only pain management and does not include psychosocial support or counseling. D. Hospice can be combined indefinitely with curative or aggressive therapies. The correct answer is B. This option is correct because hospice eligibility is based on a prognosis of 6 months or less if the illness runs its normal course. It does not automatically exclude all other treatments or services. Reason A is not correct. Hospice does not bar hospital-based treatments if they align with comfort goals, and the hospice benefit allows certain acute care. Reason C is not correct. Hospice includes comprehensive services such as psychosocial support, counseling, and spiritual care, in addition to symptom management. Reason D is not correct. Hospice focuses on comfort, and combining indefinite curative therapies would conflict with its care philosophy. Question 96. A 70-year-old patient under guardianship with advanced COPD experiences frequent hospital admissions. The guardian wants to integrate palliative care early in the disease course. Which initial step best facilitates early palliative care integration? A. Delay any palliative referral until all curative treatments have been exhausted. B. Limit discussions solely to end-of-life issues when the patient's condition is clearly terminal. C. Arrange a family meeting to discuss goals of care, symptom management, and patient preferences. D. Transition immediately to hospice care without exploring patient and family preferences. The correct answer is C. This option is correct because early palliative integration begins with structured discussions about goals of care, symptom management, and patient values, which guide ongoing treatment decisions. Reason A is not correct. Waiting until curative treatments fail delays palliative benefits and contradicts early integration principles. Reason B is not correct. Restricting discussions to end-of-life misses opportunities to manage symptoms and support quality of life earlier. Reason D is not correct. Hospice may not align with patient preferences at this stage and should follow careful goal-setting conversations. Question 97. According to professional standards for guardianship, effective advocacy during a multidisciplinary complex care conference primarily involves which of the following? A. Negotiating procedural guidelines for the meeting structure. B. Reviewing and signing off on team meeting minutes. C. Managing allocation of care team resources. D. Upholding substituted judgment by presenting known values and preferences of the individual. The correct answer is D. The correct answer is upholding substituted judgment by presenting the ward's known values and preferences to the care team, as guardian advocacy centers on ensuring that decisions reflect the individual's own wishes rather than on administrative or logistical tasks. Reason A is not correct. This distractor focuses on meeting logistics, which is not the guardian's primary advocacy role. Reason B is not correct. This distractor pertains to record approval, not direct advocacy for the ward's expressed wishes. Reason C is not correct. This distractor emphasizes administrative resource management, rather than representing the ward's preferences. Question 98. Which circumstance most appropriately triggers a guardian's referral for a second medical opinion, according to professional guidelines? A. Proposed treatment carries experimental protocols with significant uncertainty and risk. B. Recommended intervention is routine with established best practices. C. Incapacitated individual expresses full trust and no concerns about the provider's plan. D. Hospital discharge follows a standardized, post-operative protocol. The correct answer is A. The correct answer is when a proposed treatment involves experimental protocols and significant uncertainty, because guidelines advise seeking a second opinion under conditions of high risk or diagnostic ambiguity. Reason B is not correct. Routine interventions with established best practices do not generally require additional opinions. Reason C is not correct. Full trust without clinical uncertainty does not meet the standard for a second opinion referral. Reason D is not correct. Standardized discharge protocols are not circumstances that trigger specialty opinion guidelines. Question 99. A legal guardian of an adult ward with a rare genetic disorder is presented with the option of enrolling the ward in an experimental gene therapy trial. The protocol outlines potential benefits but also significant unknown risks. What is the guardian's most appropriate next step? A. Petition the court for approval before consenting to participation in the experimental treatment. B. Consent to enrollment based on the prospect of therapeutic benefit and the guardian's judgment of best interest. C. Seek the ward's assent only since the ward has fluctuating capacity but no expressed objection. D. Decline participation because experimental therapies fall outside standard medical consent authority. The correct answer is A. The correct answer is to petition the court because high-risk experimental treatments typically require judicial oversight to ensure the ward's protection and legal authority for consent. Reason B is not correct. This option overlooks the need for judicial review when significant unknown risks are involved. Reason C is not correct. This approach relies solely on assent despite the ward's impaired decision-making capacity and ignores court requirements. Reason D is not correct. This statement is too categorical and does not account for the possibility of court-authorized experimental treatments. Question 100. A guardian seeks to initiate involuntary antipsychotic treatment for a ward experiencing severe psychosis and refusing medication. Under applicable guardianship statutes, which action best aligns with legal limits on involuntary treatment? A. Authorize involuntary medication solely based on the guardian's belief that the ward poses danger to self. B. Proceed if the ward's primary care physician endorses the treatment plan. C. Obtain approval from 2 consulting psychiatrists without court involvement. D. Demonstrate that less restrictive alternatives have failed and obtain a court order before administering treatment. The correct answer is D. The correct answer is to show that less restrictive measures have been tried and to secure a court order, since involuntary treatment generally requires judicial authorization after alternative options are exhausted. Reason A is not correct. This oversteps guardianship authority by allowing involuntary treatment without required legal authorization. Reason B is not correct. Physician endorsement alone is insufficient where statutes mandate judicial approval for involuntary interventions. Reason C is not correct. Psychiatric opinions alone do not substitute for the court order needed for involuntary treatment. Enjoyed this practice test? Tap like, hit subscribe, and share it with a classmate. Got a question we should tweak? Comment below. We read them all. Find full practice exam books in the description or at ExamPrep.School.